Picture this. 7 days from now, you roll out of bed, walk to the bathroom, put that blood pressure cuff on your arm, and the number staring back at you is the lowest it's been in years. You didn't change your medication. You didn't start jogging at 5 a.m. You made 7 specific changes to what you eat. Changes that go directly after the biological root causes of high blood pressure that your prescription was honestly never designed to touch. That's what this video is about. 7 foods that work at the cellular level to bring your pressure down, and 3 hidden saboteurs in your daily routine that are silently canceling out every good thing you're doing. If you're new here, hit subscribe right now, because Dr. Jacob Allen has spent over 2 decades helping men over 50 take real control of their cardiovascular health, and what he's about to share could change how you approach this forever. Here's what's important before we dive in. Midway through this video, Dr. Jacob Allen is going to reveal 3 things, almost certainly in your home right now, in your bathroom, on your breakfast table, in your medicine drawer, that are actively working against every healthy choice you make. Skip that section, and these 7 foods will give you maybe 1/3 of their potential. Stay until the end. The second half might be the most important health information you've heard in years. Now, a quick biology lesson your doctor probably skipped. Your artery walls produce a molecule called nitric oxide, your body's built-in pressure relief valve. It tells the smooth muscle around your blood vessels to relax and expand. When those walls open up, blood flows with less resistance, and pressure drops. The problem? After 50, nitric oxide production falls significantly, and most blood pressure medications don't address this at all. They manage the downstream result without ever touching why your vessels are tightening in the first place. Every food we're about to cover works on this exact pathway. Let's go. Food number 1, beet juice. Beets carry some of the highest dietary nitrate concentrations of any vegetable. When you drink beet juice, bacteria on your tongue convert those nitrates into nitrite, which enters your bloodstream and becomes active nitric oxide. Your arteries relax on command. A study in the journal Hypertension found that 250 milliliters of beet juice daily reduced systolic blood pressure by an average of 8 millimeters of mercury, measurable within hours of drinking it. The protocol: 1 small glass every morning, room temperature. Cold beet juice slows the bacterial conversion in your mouth. That step matters. If the taste is too strong, add a splash of apple juice. Give it at least 2 weeks before measuring results. Food number 2, arugula. Most people walk right past this in the produce aisle. Arugula carries even more dietary nitrates per gram than beets, and it adds something beets don't: potassium. Potassium signals your kidneys to flush sodium rather than hold on to it. When sodium accumulates, it pulls water into your bloodstream, increasing blood volume, which increases pressure. Potassium is the natural counterbalance, and most people over 50 are chronically low on it. Add 2 generous handfuls of raw arugula to 1 meal a day. Simple olive oil and lemon dressing works perfectly, and this is non-negotiable. Do not cook it. Heat destroys both the nitrate content and the potassium bioavailability. Raw only. Food number 3, hibiscus tea. Here's something most people have never asked their cardiologist. What if a plant compound worked through the exact same mechanism as a class of prescription blood pressure drugs? Not a vague similarity, the identical mechanism. It exists, and it blooms as a flower. Hibiscus contains compounds that inhibit an enzyme called ACE, angiotensin-converting enzyme. ACE inhibitors are one of the most prescribed blood pressure drug categories on Earth. They prevent the production of angiotensin II, a hormone that constricts blood vessels. Hibiscus does the same thing naturally. A meta-analysis from the Journal of Nutrition analyzing over 500 patients found regular hibiscus consumption reduced systolic blood pressure by an average of 7.5 millimeters of mercury. Steep 2 teaspoons of dried hibiscus flowers in 240 milliliters of hot water for 8 to 10 minutes. 1 to 2 cups daily. Serious warning: if you're currently taking ACE inhibitor medication, talk to your doctor before adding hibiscus regularly. The combined effect could push your pressure lower than intended. That's not a reason to avoid it. It's a conversation you must have first. Food number 4, raw garlic. And almost everyone uses this wrong. When you crush a garlic clove, an enzyme called alliinase converts a compound inside into allicin. Allicin then converts inside your body into hydrogen sulfide, a gasotransmitter, just like nitric oxide, that tells your blood vessels to relax and dilate. Two vasodilating pathways firing simultaneously. That's what properly prepared garlic delivers. The mistake most people make: they crush the garlic and immediately throw it into a hot pan. Heat destroys the alliinase enzyme within seconds. You get the flavor. You lose every cardiovascular benefit. The fix: crush or mince 1 to 2 cloves, then wait 10 minutes before eating or cooking. That waiting period is not optional. It's the chemistry completing itself. After 10 minutes, add it to a dressing, spread it on avocado, eat it however works for you. 10 minutes. That single change turns garlic from a seasoning into therapy. Quick question. Leave it in the comments. Do you eat garlic regularly, and do you wait before using it or cook it straight away? Dr. Jacob Allen is genuinely curious how many of you have been doing this right all along without knowing why. And if you're finding this useful, subscribe. There's a full second layer to this protocol coming next week, and you won't want to miss it. Food number 5, ground flaxseed. This one has the most impressive long-term clinical data of anything we'll cover today. A randomized controlled trial in the journal Hypertension followed patients for 6 months. One group added ground flaxseed daily. The other changed nothing. After 6 months, the flaxseed group showed an average reduction in systolic blood pressure of 15 millimeters of mercury, sustained over 6 months. That is comparable to some first-line antihypertensive medications. It works through multiple mechanisms simultaneously. Alpha-linolenic acid reduces arterial inflammation directly, lignans interact with hormonal pathways tied to vascular regulation, and soluble fiber improves the gut microbiome in ways that measurably benefit cardiovascular health. 2 tablespoons of ground flaxseed daily. Ground, not whole. Whole seeds pass through your digestive system intact, and your body can't access anything inside them. Stir it into yogurt, blend it into a smoothie, mix it into oatmeal. You'll barely taste it. The only catch is patience. 3 to 4 months of consistent use for the full effect. But 3 months from now is coming whether you start today or not. Food number 6, dark chocolate. Minimum 85% cacao. Yes, really. Cacao is one of the richest sources of flavanols, compounds that activate an enzyme called endothelial nitric oxide synthase. That's the exact machinery your artery walls use to produce nitric oxide internally, synthesized from scratch using the amino acid arginine. With beet juice and arugula, you're supplying raw materials through the nitrate pathway. With dark chocolate, you're switching on the internal factory through a completely independent route. A meta-analysis across 24 clinical trials found high flavanol chocolate produced measurable reductions in both systolic and diastolic blood pressure across multiple populations. The dose, 20 to 30 grams per day. That's 3 to 4 small squares, not half a bar. The higher the cacao percentage, the higher the flavanol content, and the lower the sugar. Treat it like medicine that happens to taste excellent. Food number 7, pomegranate juice. This one protects everything else you're building. Nitric oxide is a fragile molecule. Free radicals generated by inflammation, poor sleep, and processed food destroy it before it can reach your artery walls. You could be doing everything right. Beet juice in the morning, arugula at lunch, dark chocolate in the afternoon, and still have low nitric oxide activity if your oxidative stress is high enough to neutralize it faster than you produce it. That scenario is more common than most people realize. Pomegranate contains some of the most potent antioxidants found in any food, including a compound called punicalagin that's unique to this fruit. Research shows it's more effective than red wine or green tea at neutralizing the specific free radicals that destroy nitric oxide. A clinical trial in clinical nutrition found pomegranate juice reduced systolic blood pressure by 5%, while simultaneously raising measurable nitric oxide levels in the bloodstream. 150 milliliters of pure pomegranate juice daily. No added sugar, no concentrate. Both significantly reduce the polyphenol content. Think of pomegranate as the shield protecting all the work the other 6 foods are doing. Now, full attention for this next section, because for many of you, none of what I just described will reach its full potential. Not because the foods don't work. The research on every one of them is solid. It's because of 3 things hiding in your daily routine that are systematically dismantling the biology we just spent time building. Saboteur number 1, your mouthwash. Remember the bacteria on your tongue that convert dietary nitrates into nitric oxide? Antibacterial mouthwash, the kind that kills 99.9% of bacteria, cannot tell the difference between harmful bacteria and the beneficial nitrate-reducing bacteria your cardiovascular system depends on. It wipes out both. A study in Free Radical Biology and Medicine found that using antibacterial mouthwash twice daily reduced nitric oxide bioavailability by 25%. You drink your beet juice, you eat your arugula, then you rinse, and a quarter of the benefit disappears. Just like that. The fix: switch to fluoride-only toothpaste, brush thoroughly, and if you use a rinse at all, choose a non-antibacterial formula or simply rinse with water. Your oral microbiome is not separate from your cardiovascular system. They are the same system. Saboteur number 2, your breakfast. Cereal, orange juice, white toast with jam. Refined carbohydrates cause a rapid blood glucose spike. Your pancreas surges insulin to respond, but insulin has a secondary effect almost nobody talks about. It signals your kidneys to retain sodium instead of excreting it. Sodium retention raises blood volume. Higher volume means more pressure. This is a major reason blood pressure spikes hardest between 6 and 10 in the morning. Not just cortisol, but what most people are eating right on top of that cortisol wave. Shift your breakfast toward protein and fat. Eggs with avocado. Greek yogurt with walnuts and ground flaxseed. Smoked salmon with cucumber. Foods that produce a minimal insulin response and let your kidneys stay in sodium excretion mode during the highest risk window of your day. Just this one change can meaningfully reduce your morning blood pressure peak. And your morning peak is the peak that carries the greatest cardiovascular risk. What does your breakfast actually look like most mornings? Leave it in the comments. Dr. Jacob Allen reads these responses, and the patterns reveal a lot about where people need to start. Saboteur number 3, your pain medication. This one surprises almost everyone. NSAIDs, ibuprofen, naproxen, high-dose aspirin are among the most commonly used drugs in the world, especially among people over 50 managing joint pain or back pain, and they interfere with blood pressure through 2 distinct mechanisms. First, they inhibit prostaglandins, compounds that promote sodium excretion and vessel relaxation in the kidneys. Block those and your kidneys start retaining water and sodium. Second, NSAIDs partially block the mechanism through which ACE inhibitors and diuretics do their primary job. So you could be taking your prescription faithfully, eating all 7 foods, building the entire system, and taking ibuprofen twice a week for a sore knee, quietly undoing a significant portion of it with each dose. The alternative worth discussing with your doctor is acetaminophen, which doesn't carry the same cardiovascular interaction profile. But if you're taking NSAIDs regularly for a chronic condition, do not change that unilaterally. Bring this up at your next appointment. That conversation is not optional. Now let's close the loop. Why does the morning window matter more than any other time of day? Between 6 and 10 a.m., cortisol and catecholamines surge, your primary stress hormones. This produces a sharp, predictable blood pressure spike. Cardiologists call it the morning surge. Statistically, more heart attacks and strokes occur in this 4-hour window than any other comparable period across the entire day. Your morning routine either amplifies that surge or dampens it. Beet juice and garlic flood your system with vasodilating compounds exactly when your arteries are under the most pressure. A protein and fat breakfast removes the insulin-sodium mechanism that adds fuel to that surge. Ditching antibacterial mouthwash preserves the bacteria that convert your morning nitrates into active nitric oxide before the peak arrives. These aren't 7 separate tips you can pick and choose from. They form one integrated system, designed to address high blood pressure from multiple biological directions at once. Your medication manages the downstream result. This protocol targets the upstream mechanisms your medication was never designed to reach. If this makes sense to you and you want to go deeper, there's a critical second layer involving specific mineral deficiencies, particularly magnesium, that determines whether everything in this video works efficiently or barely works at all. Dr. Jacob Allen covered it in detail in a separate video. The link is in the description. If this was useful, a like takes 2 seconds and helps other people find this information. Subscribe for the next part of this protocol next week. And as always, review any dietary changes with your doctor, especially if you're managing hypertension with medication or have underlying conditions. This is designed to work alongside your medical care, not replace it. See you in the next one.